Nice to meet you on the general lecture Human Anatomy. We continue and finish today's course about the active part of the locomotor system muscles. Topic the lecture Anatomy of the topography upper and lower limbs. Let's start from the first question, the topographical anatomy upper limb. And the beginning of the topography we have on the border between the thoracic cage and the upper free limb. Under the shoulder, we have the axillary fossa, more wider structure because internally it includes the axillary cavity, more narrower anatomical structure under the shoulder. Axillary fossa bordered by two folds, anterior fold composed by the pectoral major, covered by the skin pectoral major, I remind from the previous lecture, and one superficial muscle, the thoracic cage, and posterior fold formed by latissimus dorsi, one superficial muscle of the back which covers the biggest, widest portion, the lower back, and it incense to the crest of the lesser tubercle. Oh, another name of this crest, we also say middle border intertubercular groove. So, axillary fossa, I said, include the axillary cavity, and on this picture you see the inlet to the axillary cavity under the shoulder and the outlet from the axillary cavity above the clavicle. It will be the supraclavicular region ahead to the trapezoid muscle. Here we have trapezoid muscle, and there we have some deep muscle, the scalene muscle of the neck. And then axillary cavity has walls. It has four walls: anterior border, posterior border, lateral, and the middle. And then anterior wall composed by two superficial muscle of thoracic cage, pectoralis major and the pectoralis minor. Posterior wall composed by the one muscle of the back and two muscles, the pectoral girdle. Latissimus dorsi, first one, subscapular muscle, and teres major. Two neighboring walls, middle wall and lateral wall. Middle wall is serratus anterior, which is one superficial muscle of thorax. Exactly, it covers the lateral aspect of the thoracic cage. And the lateral wall muscle and structures from the arm, biceps brachii, coracobrachial, and the sagittal neck of the humerus. Okay, now we looking for on this measure all muscle, which I said previously on the previous slide. And then we said that anterior border, here you see the axillary cavity, look here, this space, and anterior border of the axillary cavity. We have two muscle, pectoralis major above and below pectoralis minor. We said about the posterior wall, look here, we have three muscles. Subscapular muscle, first one, next one we have teres major muscle, and a little bit from the latissimus dorsi. On the posterior wall, slightly later, I will show you we have two topographical structures, two openings. One opening foramen quadrilaterum will be more medially inner to our thorax, and good visible here foramen trilaterum. Slightly later about that. Also, we have a lateral wall. We rise slightly up. Here will be. What is the muscle here? Serratus anterior muscle. One superficial muscle covers the lateral aspect, the thoracic cage. And lateral wall, then middle wall, serratus anterior muscle. And the lateral wall structures from the arm. What we have here? We have sagittal neck, the humerus, the deepest one. Next one, we have the coracobrachial muscle, this one, and the biceps brachii. And generally, you see the complete axillary cavity below the shoulder. Content of axillary cavity. What we have there? Axillary artery and branches. Axillary artery, axillary vein and its tributaries. Branches the brachial plexus, and some lymphatic nodes. We have group of the under the shoulder. We have group of the axillary nodes generally, and around axillary nodes we have the central, apical, pectoral, subscapular, different position, and we have different names. And fat rest cavity, which is free from some vessels and nerves, filled by the fat. So here we have contents of the axillary cavity and the most visible neurovascular bundle, yes? More closer to us, like to middle position. We have the axillary vein with the branches. Next one, we have axillary artery with the branches. Around the axillary artery, you see components, the brachial plexus, exactly a subclavicular portion, the brachial plexus. There we have some bundles, middle, lateral, and posterior bundles of the brachial plexus. More about the nerves, arteries, we will have another lectures, and on the second course we will study more deeper about their structures in the axillary fossa. So I said you during explanation the posterior wall axillary cavity, there we have two openings. Well, let's start from the first image. They are more out, closer to the shoulder. We have quadrilateral foramen, which means then it has the, it's like the quadrant which has the four borders, yes? 1, 2, 3, 4. And more closer to the thorax, to our body, middle position occupies the trilateral foramen, which has like the trigon shape, and it has the three borders. Another one image show you more close about the trilaterum. Here you see region like from the front. Here you see this view from the back. Trilaterum and the quadrilaterum. Now we try and found all muscles which perform borders for our foramen, and on the next slide you will see exactly text about the borders, quadrilateral and trilateral foramen. And then quadrilateral foramen, where is located? What do you see here? More laterally, lateral border will be sagittal neck of a humerus. Middle border, which delimits the quadrilaterum and trilaterum foramen, we have the long head of the triceps. What is the muscle triceps? Triceps extensor muscle, our arm, which is located in the posterior aspect, the brachium. It has three heads, yes, long, lateral, and middle. And long head delimits trilaterum and quadrilaterum foramen. And then for the quadrilaterum, it will be middle border. For the trilaterum, long head of the triceps is a lateral border. So inferior border for our both structures, for both openings, we have the teres major. And upper border for both structures, more posteriorly we have teres minor, more anteriorly we have, here you see the teres minor, and anteriorly will be subscapular muscle. So there you see text about the borders, the quadrilaterum foramen. Pronunciation by the English will be quadrangular foramen, quadrilaterum. And then lateral border, sagittal neck, the humerus. Middle border, long head, the triceps brachii. So superior border, we said anteriorly, posteriorly. Anteriorly, subscapular muscle, posteriorly, teres minor. And inferior border, teres major. Some second I give you for reading. And we continue. Triangular foramen, trilaterum. Lateral border is the same of middle border for the quadrilaterum, yes, because the structure delimits two foramens. And then lateral border, long head, the triceps. Superior border, same, anteriorly subscapular and posteriorly teres minor, inferiorly teres major muscle. subscapular, teres minor, teres major muscle, the upper girdle, pectoral girdle. So on the image, you see the back, the shoulder. This one is a scapula, spine, the scapula, acromion, supraspinal, infraspinal muscle, teres minor, teres major. There you see two heads, the lateral head and long head, the triceps, and visible two foramen, then trilaterum and quadrilaterum. Through trilaterum, from the axillary cavity, exits artery, circumflex scapular artery. For that, we need information about the topographical structures around the artery. And through quadrilaterum, we see on the picture one artery is a posterior circumflex humeral artery and one nerve branch, one short branch of the brachial plexus, axillary nerve. Okay, and then content of the triangular quadrangular foramen. Through this one triangular foramen, trilateral, circumflex scapular artery and vein, here visible and vein. And through the quadrilaterum, we have axillary nerve, first one, and posterior circumflex humeral artery and vein. So we continue. We finish about the axillary fossa, axillary cavity, and all structures about that. And we continue. We descend downward. Now we're in the arm, brachial part of the upper free limb, and on the posterior aspect between humerus and triceps extensor muscle, the shoulder and the elbow, we have a humeromuscular canal. Sometimes we also call this canal of the radial nerve, radial canal, also you can find this name. Canalis humeromuscularis. So it's located between two structures. So one structure you see here on the back behind the deltoid tuberosities, which is located in the lateral aspect. Behind this tuberosities we have a groove for the radial nerve on the humerus. Name of the structures on the bone, groove for the radial nerve. And it will be, according to our position, it will be anterior border for canal. And posterior border for canal, we have the triceps brachii. Contents of this canal. In the canal, we have the deep brachial artery and vein, and radial nerve. That's all about the humeromuscular canal. We continue. We rotate our arm. We count on the front, the arm, and the flexor muscle of the arm. I remind you, we have the biceps with a long and short head. And beside our brachial muscle, we have two grooves. Laterally, we have lateral bicipital groove, sulcus bicipitalis lateralis, and from the middle aspect, we have middle bicipital groove, sulcus bicipitalis medialis. More superficial in each groove, below the skin, below the subcutaneous tissue, we have two veins. In the lateral bicipital groove, located the cephalic vein from the group of the superficial vein, our arm, cephalic vein, lateral position, and the middle position we have basilic vein. Basilic vein. I said more superficial content. In the lateral bicipital groove, we don't have anything more, but in the middle bicipital groove, more deeper, when we remove slightly our biceps and from each side of coracobrachial, we will find the neurovascular bundle. And a lot of components it has. First of all, we have the biggest one. You see the red color, the brachial artery. On the picture absent, but along the brachial artery, we will have two brachial veins, and then we have plural veins. more commonly, around one artery in our body, we have two veins, neighboring veins with the same name. And then one brachial artery and two brachial veins. Next, what we have? Next, we have long branches from the brachial plexus. And then, first of all, this one we have first structure is a median nerve. Median nerve. Next one here, this one which goes to the elbow, for middle aspect of elbow, ulnar vein, ulnar nerve. And the more nerve structures, we have one here nerve and one more here. This one will be the middle cutaneous nerve of the forearm, middle cutaneous nerve of the arm. This nerve innervates skin just on the brachium, and this one goes to the middle aspect on the antebrachium. Okay, I repeat again, contents the deeper structures, the deeper spaces of the middle bicipital group. We have brachial artery and two brachial veins. Next, we have just the nerves. Median nerve, first one. Here, this one, we have the ulnar nerve. Between median and ulnar, visible, which goes to the middle aspect of the forearm, we have medial cutaneous nerve, the forearm. And in the upper part, this one, we have the middle cutaneous nerve of the arm. Okay, that's all about the brachium. Then I repeat, on the brachium anterior aspect, we have two groups. Middle lateral bicipital group. On the back, we have humeromuscular canal or radial canal. And next, we have structure on the body between the brachium and antebrachium, cubital fossa, fossa or elbow. This fossa has the floor and brachialis muscle who form the floor of the fossa, and it's surrounded by a next muscle. Above you see the biceps. Lower border, middle lower border, we have pronatal teres, and lateral in lower border we have the brachioradial muscle. Okay, brachialis and biceps from the flexor group muscle, the arm. Pronator and brachioradialis from the flexor muscle, the forearm. Okay, biceps you see here. Okay, upper part, upper body will be. Pronator teres and brachioradial in the lower body, biceps and more deeper. We have the brachialis, the upper body, the cubital fossa. The cubital fossa. In the cubital fossa, we have also terminal part our brachial artery, where it splits on the radial and arterial artery and ulnar artery. Brachial artery comes here. Brachial artery is a continuation of the axillary artery. There we have also median nerve in the cubital fossa. There we have the radial vein and the ulnar vein, which join together to brachial vein, and the fat, lymphatic nodes and fat. So, topography the forearm. Topography the forearm. On the anterior aspect, you see the three red lines. Then there we have three grooves. Sulcus antebrachii lateralis, or another name, it also has the radial sulcus. Next sulcus we have the median. Okay, without another name, and medial or ulnar groove. Ulnar groove. Here you see exactly radial, median, and ulnar sulcus. The radial and ulnar have another name because position. This more laterally, this one more medially. So, and then we should know borders of each sulcus. I want to remind you some superficial muscle from the flexor group muscle, the forearm. This one from the lateral to middle aspect. Let's start. First one is a brachioradial. Pronator teres. Here you see the tendons of the biceps from the arm. And next one, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. Below those muscles, we have this one wide, visible here, visible there. We have flexor digitorum superficialis. And then first groove, which is the radial groove, located here. When we remove slightly brachioradial, we will see radial artery, which is located and on the lower part visible because near the in the lower one-third aspect of this groove, near our pollex, we can examine pulsation of this artery, yes, and we examine the pulse of our body. So this groove located between brachioradial muscle, brachioradial this one, and second muscle, flexor carpi radialis, flexor carpi radialis. The next groove located more deeper. Look, this groove located below this flexor digitorum superficialis, below this. When we remove flexor digitorum superficialis, we will find the next groove, median groove. And then how we say the borders. We say that is one border will be flexor carpi radialis, and second border we have flexor digitorum profundus, because more deep is located, but above slightly covered by the flexor carpi radialis. And the last one groove, this one, ulnar groove, located, one border will be flexor digitorum profundus, and second border we have flexor carpi ulnaris. Again, we should remember just four muscle, brachioradial, flexor carpi radialis, flexor digitorum profundus, and flexor carpi ulnaris. Between those muscles, we have three grooves: radial, median, and ulnar. So, content of each groove. Radial sulcus has radial artery, two radial veins, again two we have, and the deep branch from the radial nerve, this one. Here we have radial nerve, main trunk located on the posterior aspect of the forearm, but it gives the deep branch, which are located here in this radial groove. Next one, median. Median has only one nerve, median nerve. We can say although more deeper located, but it's like more deeper between muscle. We have the anterior interosseous artery, but is not region of the sulcus, more deeper. And the ulnar sulcus has ulnar artery, two ulnar veins, and ulnar nerve. Everything was named the ulnar artery, ulnar veins, and ulnar nerve. Okay, we arrived the last one part, our upper limb, manus, our hand, and some spaces, some structures we have also on the region our hand. And then on the border between the forearm and hand we have Parona's space, this one. Okay, and exactly on the beginning, the palmar part, like really the border between the antebrachium and the palmar part of the hand, we have carpal tunnel. Okay, Parona space, boundaries. Posteriorly, we have pronator quadratus. I remind you, pronator quadratus, the deepest muscle from the flexor groove muscle on the antebrachium, falls here. And next to pronator quadratus, we have interosseous membrane between the radius and ulna. And posterior body, Parona space, we have pronator quadratus and interosseous membrane. Anteriorly, we have the flexor pollicis longus, tendons visible here. Flexor pollicis longus and flexor digitorum profundus. If you remember, flexor pollicis longus and digitorum profundus, the third layer flexor muscle, the forearm, and then peroneal space located between third layer and fourth layer muscles, the forearm. Carpal tunnel on the palmar surface. Posteriorly, carpal bones. Okay, and anteriorly, flexor retinaculum. Flexor retinaculum is a structure, connective tissue, same of the tendons of the muscle, which support, serves, and surround the flexor muscle on the beginning of a hand. And in between carpal bones and flexor retinaculum, we have a carpal tunnel. Through carpal tunnel, on the hand comes the median nerve, which is located in the median groove of the forearm. So, and then contents of the carpal canal. Canal also we use in them. Ulnar vessels and nerve. Here we have median nerve. This one we see the ulnar vein, the artery branches of the artery, ulnar nerve. Here we see the median nerve. And tendons, the flexor pollicis longus, flexor digitorum profundus and superficialis, and flexor carpi radialis. Flexor pollicis longus, flexor digitorum superficialis and profundus, flexor carpi radialis. And last one question about the topographical anatomy of the upper limb. On the hand, we have structures which have the synovial sheets for tendons of some muscles, and we have interesting links between sheets. Some sheets are plain, some sheets have communication with the finger, and it's important in the clinic. And then which synovial sheets of the flexor muscle we have. So, first of all, near the pollex, we have first sheets, this one, which continues on the first finger, flexor pollicis longus. Along the tendons, we have the sheets, flexor pollicis longus. Next, on the palmar surface, we have the common sheets for both flexor digitorum muscle, superficialis, you see above, and profundus. For those muscles, we have common sheets. And you see this common sheets continues on the fifth finger. Second, third, and fourth finger sheets we have, yes, for the muscles, flexor digitorum. But we have like cutting between the common sheets and some individual sheets for each finger. Only fifth finger connect to our common sheets. Second, third, and fourth isolated. And then peculiarities, the anatomical structure of the synovial sheets on the palm cause the spread of purulent inflammatory processes from the first and fifth fingers, because you're seeing the first finger pollex also has a connection through the sheets of the flexor pollicis longus on the forearm, and same fifth finger, like the second and fourth finger, third and fourth finger isolated, and then processes also were isolated. So on the dorsal surface, our arm, exactly on the hand, on the dorsal surface, on the border between the antebrachial and hand, we have structures which name the anatomical snuff box, this region. Like dorsal surface, the base of the pollex, first finger. This nerve box located between two tendons for the pollex, two muscle tendons of the two muscle for the pollex. First one here is the extensor pollicis longus, and the second one we have extensor pollicis brevis. Like between two tendons, we go deeper and we'll find the anatomical snuff box. Anatomical snuff box has a next content. You see here from the top to the bottom we go, so superficial to deep. Radial nerve. Exactly here you see the branch, dorsal digital branch, radial nerve. Next one we have cephalic vein. Next one, radial artery and branches, scaphoid bone, trapezium, and base the first metacarpal. Like scaphoid, trapezium, base of the first metacarpal will be floor the anatomical snuff box. According to the structures, the radial nerve, cephalic vein, radial artery, and branches of the radial artery. Okay, and on the dorsal surface, our hand we have also sheets for extensor muscle. Around we have 6 sheets. We should now adjust the name, which don't have a connection on the fingers, only flexors. Sheets have a connection, and then below the extensor retinaculum, also we have supporting structures also for the tensors extensor muscle. Let's start from the lateral to middle aspect. First one we have sheaths for the abductor pollicis longus and extensor pollicis brevis for two muscle. Abductor pollicis longus and extensor pollicis brevis. Next one, extensor carpi radialis longus and brevis together here. Extensor carpi radialis, longus and brevis. Next one, we have extensor pollicis longus. And 1, 2, 3. Next, we have number 4, extensor digitorum and extensor indicis. Here, better visible. Index and extensor digitorum. Next, extensor digiti minimi. Here. And extensor carpi ulnaris. 6 sheets for extensor muscle on the dorsal surface. I repeat again. We have abductor pollicis longus and extensor pollicis brevis, not visible tensor here, more lateral position. Next, extensor carpi radialis longus and brevis. Extensor pollicis longus, visible sheets and tendons. Extensor digitorum and extensor indicis together. Extensor digiti minimi and extensor carpi ulnaris. Okay, and then we have second part, our general lecture, topographical anatomy on the lower limb. Let's start from the pectoral, from the pelvic girdle or the lower girdle, pelvis. And first of all, I want to remind you some structures between the sacrum and hip bones. Exactly, ligaments. After connection by ligament our bones, we have some openings. First ligament, you should remember this one, the sacrospinal ligament between inner side of sacrum and the spina sciatica, the hip. Sacrospinal ligament surround and it completes the great sciatic notch, and together we will have the greatest sciatic foramen. This one, notch and the ligament together from the greatest sciatic foramen. Second ligament, you see here, we have sacrotuberal, tuber sciatic, the bottom hip bone. And what visible? Below the spina, above we have greater sciatic notch, below the spina sciatica we have lesser sciatic notch. And this notch plus two ligaments, sacrospinal and sacrotuberal, surround second opening the lesser sciatic foramen. One more ligament, but it's not ligament, it's a membrane. Obturator foramen closed by the obturator membrane, and above this membrane, above membrane below upper pubic branch, we have obturator canal. Obturator canal boundaries by the bone and the obturator membrane. Greater sciatic foramen, lesser sciatic foramen, and the obturator canal. So, greater sciatic foramen, here you see the lesser, include one muscle, one of the intrinsic muscle pelvis, piriformis muscle. It inserts from the pelvic surface sacrum, exits. Look, here you see from inner side how it originates from the sacrum. Here visible how it leaves pelvic space through greater sciatic foramen and inserts to the top the trochanter major. So after that, it delimits greater sciatic notch on the two level. Above muscle will be suprapiriformis foramen. Below muscle will have the infrapiriformis foramen. Next one to muscle to piriformis, there you see we have gemellus superior inferior, and between gemellus obturator internus. Then between bone, hip bone, and piriformis foramen located suprapiriformis. Sorry, between hip bone and piriformis muscle, we have suprapiriformis foramen. It's really narrow space, it's not big foramen, like fissure. Below piriformis foramen, above gemellus superior, located infrapiriformis foramen. Suprapiriformis foramen include the superior gluteal artery, same vein, and same nerve, neurovascular bundle. Superior gluteal artery, vein, and nerve. Infrapiriformis foramen includes more structures. Again, we have inferior gluteal artery, vein, and nerve. After that, we have pudendal nerve, internal pudendal artery and vein. Please look differences. Pudendal nerve, but artery and vein, internal pudendal. Posterior cutaneous nerve of thigh and sciatic nerve. Last two structures, branches, long branches, sacral plexus. Posterior cutaneous nerve of the thigh and sciatic nerve. Look, vision from the back, visible sacrum. I remind you some muscle, which we have here. First muscle, gluteal maximus, is removed. Below gluteus maximus, we have medial gluteal and minimus, and lesser gluteal, greater, medius, and minimus. Piriformis muscle, gemellus superior, inferior, this one internal obturator, quadratus femoris, and visible upper fissure, suprapiriformis foramen, exactly here visible neurovascular bundle except the vein. Superior gluteal nerve, superior gluteal artery, and will be same vein. There, in the lower fissure, infrapiriformis foramen, what visible? Inferior gluteal artery, nerve without vein. Here you see the pudendal nerve, this one, and two branches from sacral plexus, the biggest one. It's really the biggest nerve in our body, and the longest, maybe because it's exactly support complete lower limb, bigger part of the lower limb. Sciatic nerve, this one, and middle to sciatic nerve, second branch from the sacral plexus, posterior cutaneous femoral nerve, posterior cutaneous of the femoris. Obturator canal includes the same neurovascular bundle, obturator artery, obturator vein, and obturator nerve. So visible is bundle from inner side. From inner side, you see here anterior abdominal wall. From inner, there you see pelvic region, pelvic content, male pelvis, and here visible opening to the obturator canal and structures. Here you see the obturator vein, obturator artery, and the obturator nerve. From the pelvic region, three structures through same canal leave pelvis and go out. And the external aspect the pelvis and the external aspect the thigh. So next structures, we have inguinal canal. Inguinal canal formed by one muscle from the lateral group muscle, abdominal cavity. If they remember something from the previous lecture, I said that external oblique muscle inferiorly attached on one side laterally to superior anterior iliac spine. And the second point attachment for pelvis will be tuberculum pubicum. But between spine and tuberculum pubicum, we have like free lobar margin, the aponeurosis, the external oblique muscle, and these aponeuroses stretch between two structures and form inguinal ligament. And above this ligament, like from the midpoint of this ligament to inner, to the pelvic region, to the pubic symphysis, arise a narrow space, inguinal canal, which has four walls, four boundaries: anterior wall, posterior wall, superior wall, and inferior wall. And then what is anterior wall? If we will say the whole extent will be the skin, superficial fascia below the skin, and external oblique aponeurosis. The main structure for anterior wall, we have external oblique aponeurosis. Posterior wall, what we have? We have the transversal fascia of the abdominal cavity, some extraperitoneal tissue, a parietal peritoneum. The main structure here will be transversal abdominal fascia. What is the roof? What is the superior border? Formed of three fibers from the internal oblique and transversal abdominal muscle. Next muscle to external oblique muscle, internal oblique and transversal. And what is the floor? Floor is the inguinal ligament. Inguinal ligament, and then the same name, inguinal canal. So on this image, visible two ring, because canal has also inlet, outlet. Inlet, we'll say the deep inguinal ring. It projects to inner side. Inner side. Sorry, I come back to through some here. Good visible, please. Again, inner side abdominal cavity. Here you see the some vessels, femoral, other infemoral vein, and inner two vessels which pass through the lacuna vasorum. Our next question for topography the pelvis, we will have deep ring. Here you see the deep ring, inguinal canal. Deep ring project on the anterior abdominal wall to the lateral umbilical fossa. Lateral umbilical fossa. This one. We have maybe little topography about the anterior abdominal wall. We have five folds on the anterior abdominal cavity. We have median umbilical fold, two medial. Okay, one letter, and we have difference in median, medial, and two lateral. Then between median and medial umbilical folds located supravesical fossa above the urinary bladder, out to medial, between medial and lateral fold. Lateral fold, umbilical fold include the working arteries, inferior epigastric artery and vein. And between two folds, we have medial middle umbilical fossa, and laterally here out to our lateral fold we have the lateral umbilical fossa. Sometimes we can use also the middle inguinal fossa, lateral inguinal fossa. Why umbilical? Because between umbilical folds. And here project in the lateral umbilical fossa, project the deep ring. Exactly here is a closet. Just visible content is a male pelvis through inguinal canal passes vas deferens, one of the internal male organ. Here you see just how it passes here. After removing peritoneum and fascia, visible opening to inguinal canal. Deep inguinal ring, lateral umbilical fossa. So I come by here, and outlet will be the superficial ring. Superficial ring bounded by the splitting aponeurosis, the external oblique muscle, which forms the two crus. One crus we have middle, one crus middle here, and lateral crus. One crus attached to the pubic tubercle, one to the pubic crest, and we have complete surrounded by superficial ring inguinal canal. Look, inguinal ligament originates from the anterior superior spine, inside here is more longer than canal. Canal begins on the midpoint, above the midpoint, our inguinal ligament through the deep to superficial ring. On this picture, better visible borders within just the text. Now we try and found complete structures the inguinal canal, borders of the inguinal canal. Here you see aponeurosis, the external oblique muscle, as well as anterior boundary, anterior border. There you see free lower margin, the internal oblique muscle and transversus abdominis. And then here we have a superior wall. A complete canal from there, deep ring, please, lateral umbilical fossa. From here and superficial ring by two crus, pubic tubercle, pubic crest, we have here from deep to the superficial. Visible anterior border, visible good superior border. Imagine the transversus abdominis and the internal oblique muscle. Just lower border unvisible because inguinal ligament below content of the canal. You remember inguinal ligament we have here. And what is the posterior border? Here you see the transversal abdominal fascia and peritoneum, fat and peritoneum. Okay. So again, I show you again projection on the anterior abdominal deep ring. Deep ring. So content inguinal canal. In the male we have spermatocord and some nerves. In female located around ligament of the uterus. This ligament fixes uterus in the pelvis, exits out to the pubic symphysis and forms the attachment to the pubic symphysis. So next, topographical structures. But we continue. From inguinal ligament, again, I show you location from here to there. Spine, tubercle. From ligament, some fibers split and form a structure which attach the structure on the pelvis, on the hip bone, to iliopubic eminence, the structure attached. And the structure from inguinal ligament to iliopubic eminence forms the arcus, iliopectinal arch. Iliopectinal arch. Iliopectinal arch delimits two openings. One opening, middle position, occupies the lacuna vasorum, opening for vessels, And more laterally, here you see second opening, lacuna musculorum for muscles. Vision from the front. Again, middle red color surround the red line, surround the lacuna vasorum, space for the vessels. Visible here the laterally femoral artery, medially femoral vein. And blue line shows you the lacuna musculorum. Through lacuna musculorum passes the musculus iliacus, which is a part of the iliopsoas muscle. Okay, and then lacuna musculorum, lacuna vasorum content. The lacuna vasorum, I said you first content. We start from the lateral to medial aspect. Femoral artery, femoral vein, and the little bit of the space occupies the structure on the picture. We didn't find it. Were visible only two big vessels. Femoral branch of the genitofemoral nerve. Femoral branch of the genitofemoral nerve. In the lacuna musculorum, we have iliopsoas muscle, exactly iliacus, visible good here, but remember, iliopsoas has the psoas major and iliacus. Femoral nerve and lateral cutaneous nerve, the thigh. Iliopsoas, femoral nerve, lateral cutaneous nerve, the thigh. Femoral artery, femoral vein, and femoral branch of the genitofemoral nerve. Okay, medially to lacuna vasorum, we will have one yellow color surround this opening. Femoral ring is a weakness place. It's located in the normal our body, but it is a weakness place because sometimes there arises a femoral hernia. Femoral ring. Slightly late about that. I want to show you one structure because the structure like continuation of explanation about the hernia, because femoral hernia through this opening comes on the thigh. Below the inguinal ligament, located cribriform fascia, which is a continuation the fascia lata. It covers the anterior and lateral group muscle at the time. And after removing the cribriform fascia, visible hiatus saphenous, opening below the skin. Through this opening, vena saphena magna, great saphenous vein, one of the superficial vein, the biggest vein from the superficial group available. Vena saphena magna through hiatus joins to deeper vein, to femoral vein, and carries blood toward the inferior vena cava through this vein. But through this hiatus, when arises the femoral hernia, hernia comes on the thigh, visible through the femoral ring, through hiatus saphenous, femoral hernia comes under the skin on the anterior middle aspect of the thigh. And then normal structures is a femoral ring, because abnormally is a hernia and femoral canal, which arises after moving hernia on the thigh. A femoral ring is a normal topographical structure of a body. And then femoral ring has also borders, anterior superiorly inguinal ligament, medially lacunar ligament, posterior inferiorly pectinal ligament, and laterally femoral vein. 3 ligaments around and the femoral vein. Only fascias surround, like tendons surround the ring, and then is so weakness structures. So again, I show the text, and after show location the femoral ring. Inguinal ligament, pectinal ligament, and lacunar ligament. So here I show you exactly where is located femoral ring. Lower part, our anterior abdominal wall. Here you see vision from inside. This one, lacuna vasorum with the femoral artery, femoral vein, and medially to femoral vein we have femoral ring. So we said that lateral aspect, lateral border, femoral vein visible. Middle border, it will be lacunar ligament here. Above we have inguinal ligament, and there below we have pectinal ligament. 3 ligaments and vein surround the femoral ring. You see, it's located above the pubic, upper pubic branch, the hip bone. Okay, and then through femoral ring, which is during rising hernia, which becomes the hernial inlet. Femoral ring will be inlet. During hernia arise the femoral canal, walls of the femoral canal. So anterior wall we have inguinal ligament. Posterior wall we have the deep layer fascia lata. Fascia lata, you remember here we have. And the lateral wall we have here we have the femoral vein. And then now we try and find on the picture. Here we have the inguinal ligament. You see first point, upper border. Laterally, you see here we have the femoral vein and the continuation the fascia lata. And together around this structure arise the femoral canal. And the femoral canal inlet, I said it will be a femoral ring, outlet, hiatus saphenous, and after that hernia comes below the skin on the thigh. Okay, let's continue. We have structures of the femur, and then up above the hip, pelvic region, you will remember, suprapiriformis foramen, infrapiriformis foramen, lacuna vasorum, lacuna musculorum, inguinal canal, and femoral ring. Sometimes femoral canal when there is the hernia. And then on the thigh below the inguinal ligament, we have trigone. Now I show you this trigone, upper border, this one, inguinal ligament. Lateral border, next one, we have muscle, anterior group muscle, flexor muscle of the thigh, sartorius muscle. And one we have medially, this one muscle, adductor longus muscle, adductor longus. Inguinal ligament, sartorius muscle, and adductor longus. Trigone include the neurovascular bundle from lacuna musculorum and lacuna vasorum, 3 structures, 3 femoral structures, femoral nerve laterally, femoral artery median position occupied there in the bundle, and the femoral vein. Bundle located in the femoral trigone, sartorius, adductor longus, and inguinal ligament. And you see here are structures. More deeper, the floor for our after removing the sartorius, visible floor for trigone will be iliopsoas muscle and the pectineus muscle. Femoral trigone here continues downward to middle aspect the thigh to adductor canal or Hunter's canal. Canal has 3 boundaries. So first one we have vastus medialis, quadriceps femoris has straight rectus head, and vastus intermedius, medialis, and lateralis. And then one body we have the vastus medialis. Second one we have the adductor magnus. Longus was more higher for the trigone, and magnus more lower located. Adductor magnus vastus medialis the quadriceps, and between them we have lamina vasto adductoria. These three borders for adductor canal. In adductor canal, we have continuation the artery, femoral artery. We have femoral vein, and we have one branch from the femoral nerve, saphenous nerve. You see here signature, the femoral artery, vein, and saphenous nerve. Saphenous nerve branch from the femoral nerve. Hunter's canal, middle aspect, the thigh. We continue. We descend downward under the knee, popliteal fossa, rhomboid shape fossa, has four borders, four upper, lateral and middle, and four lower, lateral and middle. Two upper border of the rhomboid fossa. Here you see the really visible real muscle. We have biceps femoris, this one. Is a lateral, and medially upper we have the semimembranosus, semitendinosus, semimembranosus, two muscle, 1, 2, and two lower border formed by muscle of the flexor group muscle, posterior flexor muscle of a leg. This muscle from the group, the flexor muscle, the leg, triceps, which I remind you has the gastrocnemius and soleus. Exactly, gastrocnemius more superficial, gastrocnemius, two heads of the gastrocnemius attached to popliteal fossa and surround two lower border, middle and lateral. And biceps femoris, semitendinosus, semimembranosus, and two heads of the gastrocnemius, four bodies, popliteal fossa. Popliteal fossa has content neurovascular bundle. There we have popliteal artery, vein, and and there we have the tibial nerve. Around also we have the fat and the lymphatic nodes. So popliteal fossa structures, we said the popliteal artery, vein, and here you see the branches of the sciatic nerve. Exactly, branches of the sciatic nerve, we have two big branches. On the top, the popliteal fossa is split on the tibial nerve and the common peroneal nerve. Common peroneal nerve deviate more laterally, and then in the popliteal fossa we have just the continuation, the one branch from the sciatic nerve, tibial nerve. Popliteal artery, vein, and tibial nerve. So on the leg, or crus, yes, leg translated by Latin crus, we have neck structures, continuation the popliteal fossa, cruropopliteal canal, this one. Cruropopliteal canal located between neck structures. It's located between superficial and deep muscle, flexor group muscle of the thigh. And then posteriorly, closer to us, we have soleus, deeper parts of the triceps muscle of the triceps sura translation, triceps of the leg, and anteriorly, more deeper from us, we have the tibialis posterior and flexor hallucis longus muscle. Okay, this one you see the soleus muscle. Okay, this one the flexor carpi, flexor hallucis longus, and the tibialis posterior. Cruropopliteal canal includes the tibial nerve because it continues from the popliteal fossa, posterior tibial artery, and posterior tibial veins. I remind you, you see the plural because two veins around one artery we have. So next two canals we have. On the anterolateral aspect, we continue to the superior musculoperoneal canal, this one canal, in the boundaried by the upper one third of the fibula, this one, middle border, and laterally we have peroneus longus muscle, superior musculoperoneal canal, fibula, and peroneus longus. It contains structure, branch, one branch from the sciatic nerve. I said your sciatic nerve in the popliteal fossa on the beginning gives two, tibial continues to popliteal fossa, common peroneal deviates to the lateral aspect around the fibula and occupies the superior musculoperoneal canal, common peroneal nerve located here. And we have inferior musculoperoneal canal, this one. Also lateral aspect, but posterior lateral aspect. Superior musculoperoneal on the superior anterior lateral aspect, yes, inferior musculoperoneal located on the posterior lateral aspect. Okay, bodies of the canal. Anteriorly, we have lower one type of fibula we don't see because it's more deeper from us. We have here muscle, and then anterior border we have fibula. Posteriorly we have flexor hallucis longus and tibialis posterior here. So superior canal has middle border and lateral. Inferior canal has the anterior border and posterior. In both types we have fibula, like one component boundaries both canal. In the superior canal middle border, in the inferior canal fibula is anterior border. In the inferior musculoperoneal canal, located peroneal artery and veins. Peroneal artery and veins. So, some minutes and we will finish our lecture on the foot, on the plantar surface. Besides the flexor digitorum brevis, we have also two grooves. One will be the medial plantar groove, second one the lateral plantar groove. In each groove located two terminal branches from the tibial posterior tibial artery, plantar medial and plantar lateral artery. When we will say the exactly borders of the each groove, medial plantar groove located between abductor hallucis and flexor digitorum brevis. Lateral plantar between abductor digiti minimi and flexor digitorum brevis. So, last one question, the sheets for some tendons, muscles on the dorsal and plantar surface of the foot. Similarly on the hand we have. And then, first of all, like on the hand, I remind you, we have just two retinaculums, yes? One for the flexor retinaculum, one for the extensor retinaculum, for the extensor muscle. There we have two retinaculums for extensor, the superior and inferior. On the foot, we need more strongly supporting protection tendons. Two retinaculums for extensor we have, and sheets, extensor sheets. And then we have here three sheets. If you remember, we have three muscle, extensor muscle on the leg. One is will be tibialis anterior. We have sheets for the tibialis anterior. Second one, extensor hallucis longus, will be sheets for that. And for extensor digitorum longus. And then sheets tibialis anterior, extensor hallucis longus, and extensor digitorum longus. So, of the lateral aspect, we have same two retinaculums for peroneal muscle, superior and inferior retinaculum. And we have one only sheets for the both peroneal muscle. On the lateral aspect, I remind you, we have peroneal longus and brevis muscle, and for both muscle, we have sheets for peroneal muscle. On the middle aspect, we have only one retinaculum for flexor muscle, Here we have just one retinaculum and three sheaths: tibialis posterior, flexor digitorum longus, and flexor hallucis longus. Tibialis posterior muscle has sheaths, flexor digitorum longus, and flexor hallucis longus. Okay, on the plantar surface. So we have a sheath for the flexor digitorum longus, which is a continuous from middle aspect. Okay, and next we have flexor, also continuation, the sheath flexor hallucis longus. And the last one, additional sheath for the peroneus longus muscle, for the peroneus longus. Time up. Thank you for your attention. Have a nice day. Bye.